To share with you a little bit about my professional journey. I chose to talk about my professional journey to really reinforce the idea that there's no one right track in this field. No matter just, even though we're drawn into this field to help others, sometimes there's this idea that one must graduate at 22, be done with their master's at 26, be in the field, know what they're doing. And I'm here to say that that's not always the case. And I'll share a little bit with my story with you, and hopefully some of that resonates with some of you. Then we're going to focus the remainder of the workshop on you and what doing some self-reflective work to think about what brings you into the helping field, coming together to talk about what your own strengths are as a helper. Uh, as Professor Sida knows, I love motivational interviewing, and if we have time, we'll tie in a little bit of some ideas on how you can build your clinical strengths, and even if you're just starting out as a helper, just some ways to get you going and building your confidence and working with others to help promote your journey. And then I'm also just going to share with you just a couple of things that I'm doing with part of the work at the School of Medicine with some of the financial supports and programs that we might have available that would might be of interest to some of you. So I know it's difficult to stay still for this long time on a virtual platform, but my goal is that there's something in there that you can sprinkle into your own work or inspire you, and or to maybe you come back and ask more questions, just activate curiosity, and hopefully there will be some takeaways in today's workshop. So I'll talk, yeah, just expand a little bit on that introduction about why me? Why am I selected to be here today, and what could I potentially offer many of you? Well, as mentioned, I have been a professional counselor in Nevada for over 20 years. I've worked with adults, adolescents, and have done a lot of work in community care. So most of my clinical training has been working in clinical mental health settings, working with those who have been justice impacted, primarily adolescents who've been referred through the juvenile justice system. So I did that for 8 straight years, working primarily with young adults referred through youth parole or youth probation and going into detention centers and really hoping to make an impact on those individuals. I've also worked in prisons, unhoused services, and then with problem gambling services, helped overlook a program there as well. And then I've also done my own private practice for over 10 years. I've also had the opportunity to work in academic training centers to work with bachelor's level and graduate level students. I'm also a state approved supervisor, so I'm what we call dually licensed in addiction and in mental health. So here in Nevada, that's licensed clinical alcohol and drug counselor supervisor, as well as a clinical professional counselor supervisor. And then I also have a PhD in counseling, which a lot of people don't know exists. Sometimes we think PhD, we might automatically think psychology or just another scientific field. So I was very thrilled to discover and complete a program that emphasizes counseling, counseling skills, counseling education, supervision, advocacy, really reinforced all the areas that I just absolutely love. My dissertation was on corpus linguistics and building the therapeutic alliance, which is why we'll talk a little bit more about the importance of the therapeutic alliance and the language we speak, and some of the subconscious communication that can be conveyed in building or maybe not building that communication. As mentioned, I've worked in 20 different universities over the years, and now I'm very happy to be part of Be Here Nevada as Associate Director for the statewide initiative to increase and retain the behavioral health workforce. So this allows me to take the skills I've accomplished over the last 20 years and really try to do my best to build and inspire a next generation of behavioral health providers. And I love what I do. So doing this 20 years, we'll talk about how I've been able to battle any burnout, have a work-life balance, and continue to love what I do. So that's like a CV, an overview of my professional experience. But I wanted to spend some time just going more personal and sharing with you how I got from there, from like the beginning to where I am today. So if you allow, I'll just spend a little bit of time going over that personal journey. So here's some pictures. I feel like pictures convey a lot. And so here I am as a teenager. I grew up in Nevada, in the Las Vegas area. And I identify as Mexican American, fourth generation. And so I come from, I would probably say, a lower middle class environment. I mean, we were certainly privileged in many ways, but also had to work very hard. So I got my first job, I think probably a week after I turned 16 years old. In fact, I probably started at 15 and a half with the work permit. And so my first job there was at TCBY, which was a frozen yogurt shop in Las Vegas that was within walking distance of where I lived. And there I was at Valley High School in Las Vegas, part of the Honor Society. But just take note, the all the black, because we're going to talk a little bit about during this time was also a time where I battled a little bit of depression and my own mental health issues. So let's talk about that. So I did have a tougher teenage time, and I think many of us who are interested in the mental health or addiction field may have had some personal experiences, either with mental health or knowing somebody who's gone through something, or just experiencing high levels of stress, and really recognize the benefits of services. And so this is kind of what got me to really come to the idea of treatment and what counselors can do. So when I was younger, I struggled with anorexia nervosa, and so did a lot of restricted my eating, and really started having a lot of ruminating thoughts about calories, watching my weight, to the point where I lost about 62 pounds within, I'll say 7 or 8 months. So it was pretty excessive at the time, which caused just other types of physical effects, losing my hair. My skin was dry, lack of energy, of course, and depression, to a point where I could not even go to school. I couldn't get out of bed. If I did go to bed, I was not paying attention. I wasn't focused. And so I just got to the point where I dropped out of high school in the 11th grade. So think about that. 11th grade, and wow, what is a dropout going to do with their lives? And so thankfully, I was very lucky that we found a 30-day residential facility where I was able to access some treatment. And it wasn't even available in Nevada. So this is why we need behavioral health providers. I had to go out of state to access treatment for my eating disorder. And then once I was completed that program, moved back to Las Vegas, and then found some counselors here to provide ongoing counseling. So that's where I was just learned the benefit and the beauty of therapy and counseling. And this is where I got to meet amazing counselors and different modalities and styles. It's also where I met some that were not so good, and I learned what not to do to because I was still a teenager myself, and so some of these individuals who I would see would treat me like I was not my own expert, or that give me advice and just tell me what to do, and really disengaged the therapeutic alliance. So it was a really just a good learning experience for me. And from there, not only did I learn the tools to manage my own depressive and ruminating thoughts, it gave me that really great appreciation for mental health services, well enough to go back to adult ed briefly, till I got to the point where I was able to take my GED, pass it, and then I started community college, which here in Las Vegas is called CSN. And I started off interested in theater and psychology. So that's kind of where this led me here to like, this is now my kind of not so traditional educational track. So again, high school dropout, adult ed, GED. and now trying to figure out what to do at 18 years old. So I started CSN at community college, taking theater classes, psychology classes, my English classes. Again, trying to figure out what to do. To the point where I finally decided psychology was an area of interest. And so I was able to accumulate enough credits to transfer to UNLV and start their psychology program in bachelor's. And so then from there, I really was interested. I said, I like this. Like, what else can I do to expand my area in psychology? But I didn't know really much about the mental health field besides being a psychologist. So I was really lucky that when I was finishing up my bachelor's degree, I decided to work as back in the day, we called it a secretary, but I was the assistant to a psychologist there named Dr. Saskin, from who I will always be grateful, because he told me, Roberta, what about counseling? If you're not in a position to apply to a PhD program in psychology, why not a master's in counseling? And I was blown away. Like, what is this whole counseling field? And so he guided me on the right track. And so I'm grateful for having him as that mentor and guide, and hope that many of you find that mentor guide. Just sometimes that's all we need is somebody to give us that information that we didn't already know. And so I was able to enroll as a non-traditional, actually a non-degree seeking student for about 4 or 5 classes till I kind of just got my application ready, and I took the risk, took classes, got to know the faculty, and was eventually accepted to that program. During that time, I worked graveyard for Dr. Saskin because he was a sleep specialist, as a psychologist and sleep specialist. And so I would work graveyard as a polysomnography technician, working with people who were potentially had sleep apnea, and would do very much like this picture. That's not me, but that's something I would do on a nightly basis while I was going to grad school. And so eventually, when I finished, fast forward, got my PhD, started teaching as a grad student, uh, thanks to Dr. Larry Ashley, and then eventually got a PhD from Oregon State University. During this time, though, life wasn't easy. So, because I wasn't doing this by myself, I became a young mom. I was 22 after a brief marriage, was on my own. So these are some young pictures of me as a 22-year-old, figuring out, just figuring things out and trying to manage going to school, working graveyard, and raising a child. So just here to say that it isn't easy. So for many of you who are non-traditional or going back to school, just to give yourself some kudos because it is difficult. And so thankfully for me, I had some family support to help me through those tough years, but made it to the point where I am more currently. So during that time, I was able to get licensed, work in the field for many years. And as you can see in this middle picture, that same little boy got to see me 3 years ago at 48 years old. Again, not your traditional student, get her PhD. So that's me in a very proud moment. After working in the field, I was licensed, worked in the field for about 12 years before deciding to go back. And it took me about 5 years to complete my PhD in my 40s. And during that time, I've had a chance to work as a faculty member for Nevada State for many years, for UNLV. The bottom picture is me defending my dissertation. So very proud moment. That's the day I became a PhD. The top corner is with our just former UNLV president, Dr. Keith Whitfield, with my current executive director. And now I'm just lucky enough to be working at the School of Medicine. And balance, right? So I'm trying to say, like, yes, working hard, but I threw this slide in to say that work-life balance is so important. And that's how I've been able to endure so many years, 20 plus years of working, schooling, family obligations, without the fun in life. So these are just ways that I currently like to stay connected. And as you all mentioned, as I mentioned, I always liked theater from the beginning. Well, thankfully, my son went on to become a theater major, so I kind of live vicariously through him now as he's on stage or gets to go with me to theater experiences, and then getting a chance to travel. That top picture I took 2 weeks ago because I like punk rock music. So the getting to meet punk rock musicians, Latinx punk rockers, traveling, having parties, going to sports events. And so just really emphasizing that life work balance is so important, and incorporating fun in your life is really, no matter what, finding moments to keep that life balance is key. So as you can see, not the traditional, and I imagine many of you are not following a traditional track from A to B. We're all going to have our own roadmap, our own journey to get to where we want to. And no matter what, enjoy it while you can. Like there's just opportunities to learn, to pick up. Those days I worked as a sleep tech helped prepare me. I learned interpersonal skills as I would put those electrodes on people's heads. I had to help put people at ease because they were nervous. I had to reassure them. I spent 45 minutes with people, so how to engage in conversations. So no matter what type of position or role I've been in throughout the years, it's really just been building blocks and building skills to where I am today. And so all those little things, even if they're not the most ideal, will make you unique in your line of work. So that was just a little bit of how I got here. And so I'd like to now shift gears and to really have us all think, you all think about how you got here. And don't worry, I'm not going to ask any poll questions or anything like this. This is all reflective in theory, but just take a moment to maybe along with the slides, think about what your roadmap would look like. Like if you were to like have that little visual roadmap of how you got to where you are now, maybe what were some of those pieces? Got that those little marks that maybe led you here. For me, it was maybe meeting that one counselor who helped me get through some of my eating disorder issues. Or maybe it was Dr. Saskin who said, hey, what about counseling? Or maybe it's your professor here talking about mentioning a topic that you never knew about that just fills you with excitement. So just thinking about your roadmap and what got you here, because you're here for a reason. And this is part of being here today and being part of this program is part of that journey. And so part of that self-reflection is really I should probably backtrack. It's really important to do a lot of self-reflection in this work. It's really important. It's really kind of our ethical expectation to think about what we do and how we're impacting the work that we do with others. Because bottom line is that we're kind of using ourselves as a tool in the therapeutic alliance. So it's really important for us to be really attuned to who we are. And part of that is thinking about or recognizing why we're doing what we're doing. Are we doing it because somebody told us to do this? Hopefully not. Hopefully there's a reason that you're drawn into this field, but it's also identifying what that is. And also thinking about what are your gifts that are going to help you serve as an effective helper? Because every one of us in here has unique gifts. So I'm going to be a very different counselor than Daniel will be, or your professor Sida will be, or everybody in here will be unique and effective in their own unique manner. We also have to think about what areas that we might need to achieve what we seek. So what do we need to work on? Like if we feel like there's a roadblock, or we feel like there's burnout, or we feel like, oh, something's just not quite right. I'm not balanced. What do I need to work on to get through that? Because it's really important, because if we're not our full selves, or we're not our healthy selves, it's going to affect our work with clients. And then thinking about what practices are you doing to achieve your goals in this field? Because as much as we are in that journey and we want to learn as much in our current stage, it's also important to think about what might that next step be? What can we do to achieve that next step? What are some action steps I can take to move along my journey? Because it can be very easy to stay stagnant. It can be very easy to say, "Oh, I'm just taking my class, and I'll just take my next class." And maybe there's an opportunity to do a little volunteer work, or maybe there's an opportunity to read a book, or maybe there's an opportunity to seek a mentor in the areas that you might be already be interested in. So I'd like to also just think about what makes you unique. Because like I mentioned, each one of you is unique, and each one of us brings in strengths as a helper. So I'll give you just kind of a little like head start when it comes to your strengths, because chances are most of you fit the bill on this checklist of strengths that really promote effective counseling or helping in this field. Chances are there's a lot of resilience in your life and in this room. So you may come from a non-traditional background, may have had challenges in your life, yet here you are. So that resiliency is really going to help promote you in this line of work because it's not easy work. There's going to be some challenges, and we'll talk about that. Chances are there's a lot of empathy and kindness in this room. There's compassion, there's being caring, but there's also being determined. I imagine many of you are good listeners. I know that's often a cue, and I ask students like, "Oh, what kind of led you to this field?" And typically that they say, "Well, my friend says I'm a good listener, or I give good advice, or people come to me when they're having their struggles." So they've already kind of identified you as that helper or that person. So you already have those natural tendencies. So going through training and education is just going to help you hone that. You already have those strengths. Being determined. So chances are if you're in school, there's already a level of motivation and determination. Some other things that could bring a lot of strength into this field is being solution focused. So not focusing on all the problems, keeping that strength-based, focused idea, because that's going to help guide you in your client care. And then another thing that sometimes maybe we don't think about as helpers or counselors, but it certainly does help if we are a little bit more creative or think out of the box. So that's where you're going to bring that uniqueness in. So if you like, maybe you're creative in the kitchen, maybe you're a creative writer, maybe you play music. All of those ways of exploring creativity can be brought into the work that you're going to do as a helper. And honestly, just being you. So coming back, we need more representation in this field. Oftentimes individuals seeking help, like counseling or support, they want someone with similar cultural backgrounds or just other, not just ethnically, but maybe age-wise, maybe interest-wise, maybe just coming from a rural background. It could be that just that way to connect. So just thinking about who you are and all that, just who you are on a culture, in a cultural level, your religion, your spiritual beliefs, how you present, how you dress, your interests, all of those cultures and subcultures are really part of that uniqueness that's going to help you connect with individuals. So chances are many of you, and I keep seeing Daniel's name or Corin's name, those are names I see, you're going to have a different relationship with clients than I would, because chances are we have a different cultural background and perspective that our clients are going to connect to and attune to. Uh, Going back to those strengths, though, for those who are interested in pursuing a role, a professional role in the field, it is important to get formal training because we really don't want helpers in the field without having that sort of foundation. We want those to come in with education and training and just supervision, super important. And that's where it can be very challenging. That's a little reason why I mentioned to you, like, wow, I had to work graveyard. I had to have just attend to my child. I was exhausted sometimes, and it can be a little challenging to go through the formal training, not to mention the type of work we do. We're listening to trauma. We are listening to children discussing some pretty difficult situations. We're listening to people with end of life conversations. So there could be an emotional toll on top of already what we're doing with our training and our life experiences. So learning how to manage having a life work balance to avoid burnout or compassion fatigue. So that's part of what that formal training will support you in, but it's also taking those initiatives to start those practices early on. But again, this work can be extremely rewarding. And what I love about this field is that there are so many options available to you. So even if you don't know exactly what you like to do as a professional counselor, you don't need to. Like there are so many areas that might call to you, and you might, like for me, start off working with teenagers, and I loved that for 8 years. But then I decided that I needed a change, and then I decided to work with little ones, referred through Department of Child and Family Services. So I worked with like 5 and 6 and 7 year olds, but that was about for 6 months because that's when I realized I did not like that population. That was a population not for me. For my coworkers, they loved it. So then I went on to work in other community health settings and as well as doing more academic training at that point. So there's always like if the beauty of this skill is of this field is that if you start off with one, there's another door that is always going to be open to you. And so to enjoy that journey. Like the next slide says, it can be fluid. So you don't have to feel that pressure to make that one decision, and that the journey can be at your own pace. So I just want to take a quick moment to give a shout out to the organization that I'm part of now called Be Here Nevada. And we are a statewide initiative to build and retain the behavioral health workforce. And I want to go just quickly come out of my PowerPoint. And I'll provide the PowerPoint as well, so you have a link, or if you just click on Be Here Nevada, we have just updated the website to just, oh, let me get rid of it. I can't see it myself. Oh, here we go. To show you just the many different pathways that are available to individuals. So one of my colleagues put this together. It is amazing. This, if you're still kind of unclear of what the different behavioral health or mental health roles are out
Dr.
there.
Miranda, we're not seeing your screen.
Oh, you're not seeing my screen? Okay. Let me stop the share for a second and then I'll come back to it. Let me see. Let me see if you can see it now. Can you see this? Like
Yep,
where's
there we
this
go.
browse by program?
Yep.
Okay. Thank you. Okay, so Be Here Nevada. So that's as part of, if you type in Be Here Nevada, this should come up. And this is a nice program directory where you can learn, and I'll just click on one, the different type of high school and bachelor's level certificates that are available to you for, this is all Nevada based. So if you're interested in learning more about GBC, Human and Human Services, you can, guess what, learn more. And it should take you to the appropriate website. So this is a great opportunity. Oops, I have to.
That's a faster way to get our program than our website.
It's like,
That is going to be
surprise.
my new way to get to
Just send
our
us
own
this way. Yeah.
resources. Yeah.
Yay. So, or if you're interested in counseling, for example, like, well, okay, what are the clinical mental health counseling programs? We can talk about minors that are available in the state, bachelor's level, uh, master's level, doctorate level. So this is just a great resource to have to get you started on what is available as far as psychiatric nursing, school-based mental health, like marriage and family therapy, addiction. And it doesn't take you to the licensing boards, but it takes you to this, what the some training opportunities and educational tracks.
Yeah,
So,
these kinds of tools can be really helpful when you're exploring what direction you want to go and kind of creating a path to yourself because it helps you conceptualize the amount of time, energy, and training you're going to have to take on in order to get to a certain. I think a lot of times it becomes really nebulous in people's minds. When I'm talking to students, I'll say, "Okay, well, what do you want to do?" You know, but when you see it kind of laid out this way, it can help you make more informed choices. That's why these kinds of programs are so important. When the bill went into effect, it created basically the line item budget for Be Here Nevada to exist. So they had funding to produce these kinds of programs.
mhm,
Uh, it was like a wake up call that we realized that Dr. Hunt, who's the executive director of the program, without her influence and drive and determination to get this up and running, we wouldn't have these tools to keep and retain the talent that we produce in Nevada. So one of the issues is that we'll educate folks and they might move away in their graduate program and never come back. Um, at GBC, we want to keep you in your home community. So one, you're supported by your families and friends and have a social life in addition to going to school. But then you can stay and practice in those areas and support your community afterwards.
abs- yes, thank you. Absolutely. Yes, that's why we're here is to help keep you all here. Well, we don't have enough providers in the state, especially in our rural areas. We have a huge shortage. So that's one of the reasons we really want to promote the idea of a behavioral health provider at all levels. Because we understand not everybody, maybe is interested in graduate school at this point or pursuing a PhD, but there is just some amazing work that could be done at a community health worker level. In fact, I'm going to be, I'll talk a little bit later, but I've connected with some amazing community health workers in the rural areas who are just doing just outstanding work and they're passionate about what they do and professional and they're making such an impact on their communities. And they are happy with that position and making an impact. So that's where this kind of work can be just so rewarding on every level. So yeah, so thinking about that, like just that's a nice just way to explore the different areas because part of Be Here Nevada, and I'll shoot just another plug while we're talking about Be Here, is that we are here to serve as a resource to you. So an example is today, like I did a guest lecture for a UNLV Human Services course a few weeks ago, and one of the students reached out to me and said, "I have more questions. Can you tell me a little bit more about what my options are if I'm not accepted to this grad school program?" And so I had a Zoom meeting with her for 45 minutes today, going over some of these different options. So we're here to provide kind of that individualized like support. If you still have some questions, we're putting together some pre-recorded information sessions that you'll be able to click on. You can see our website if you just want to go around and just explore the different academic programs for our state. So we're here to provide you as a resource, maybe provide ideas on like if you're interested in a mentor. We're collecting a list of potential mentors in different areas of the state as well as the field. And then we also have some scholarship opportunities that I'll go over to as well. So just think of us as like a resource of like, gosh, I'm not sure exactly what to do, or I remember that one thing Roberta said during the presentation, but I can't really remember. It's just as long as you can remember, Be Here Nevada, then you can find us and be happy to answer some of those questions for you.
It's important, this concept of a mentor. Um, it's going to it's going to create a relationship, but it's going to cause you to kind of stretch yourself and reach out to someone and ask for help. Those of you who want to do it alone or have done it alone, none of us got here alone. We all depended on somebody reached out, a hand to us and helped us bring us into the field. And those of us who are brave enough to ask for that help and resource will find that they go further than folks who kind of just try to do it on their own. There's so many things that you don't know about the field. It is changing all the time. And after I leave the field, it'll change tremendously. So, you have to challenge yourself to say, I'm going to find someone that can mentor me. Ask them, humble yourself. It's not an easy thing. I had a wonderful mentor with my previous supervisor. He mentored me for 10 years before he retired. And I would, and I miss that relationship, but he deserves his retirement. Uh, but without him, I would not have had the courage to go and do different things. He challenged me to push myself further and remake the field. He's like, yeah, there are a lot of people out there that want things to stay the same, but they need to change. And he saw that kind of fire in me and cultivated it, encouraged it, and supported me through it. So I absolutely tried to extend that to all of our students. But at the same time, once you leave the academic sphere, you'll need a professional mentor to guide you through. And Dr. Miranda mentioned Professor Ashley. He was an inspiration guide to me too as well. I did not want to do substance counseling. I thought that was just something a population I didn't want to serve, and I realized after getting kind of roped into it and eventually taking over his teaching position at UNLV, that it was absolutely where I wanted to be, and it became an area of focus and specialty for me. And so that helped serve me, and that specialization helped me land other jobs at teaching positions at UNR and training positions, and then ultimately where I'm at right now. Without that experience, I wouldn't be here. So, in addition to challenging yourself, the expectation is that you're resourceful, that you look for resources, that you take this web page down, you save it in your favorites, you write it down, you write down questions you want to ask, you stay organized, you make informed decisions based upon your own research, and you ask questions for those questions you can't answer yourself. Because as a counselor that's not resourceful, you're no good to your patients. You've got to be able to help demonstrate and teach those skills as well, so they can become more self-reliant, resilient, just like we develop that for ourselves. So enough interrupting.
No,
Please continue.
no, it really no, it coincides with everything. And I could sit here and say yes, yes, because it was also Professor Ashley who invited me to teach my very first academic class because of those relationships. And because I taught that one class, it led me to 20 plus years of teaching. So it's just wonderful to, like you said, be a little brave and establish those relationships, ask for help, for support. And then those relationships can just go a long, long way. We have a very small behavioral health community, academically and professionally. And so the more people that you can connect to, the more chance doors could open to you, especially when it comes to like letters of recommendation or applying for a position. Sometimes all it takes is like, a name or a person or a reference that could open those doors. So the relationships are really important. So getting out of our comfort zone a little bit to reach out and setting up a Zoom meeting or an email, just sometimes even just an email, because I'll recognize previous students right away. I just was reached out by a previous student that I taught 5 years ago, just this past week, where she asked me a question, and I like, wow, I remember, and so it was just nice. It's just nice to stay connected. Stay connected. So yeah, I want to talk a little bit as we're talking about the helping field and that importance of getting to know your own uniqueness and how that's going to tie into your work as a helper. It's just really important, like we said, to know thyself because this is what's going to serve as your roadmap to helping potential clients. Because so I really want to dismiss the myth that a counselor, should look like this person in a movie, or like this one thing I saw on TikTok, or this person, because counselors, helpers come in all shapes and forms, and that's beautiful because so do our clients, and that's where you knowing yourself and bringing your uniqueness is going to serve as your own roadmap to helping your potential clients. now or in the future, because it's going to help you build your communication style. So if you love Star Wars, Star Trek, mythology, it's okay to introduce that into your conversations with clients to build that therapeutic alliance, to build a connection. Uh, because this will help you also build a unique toolbox for clients, build your own strengths. So if you love the arts, then use part the arts to incorporate some of that into your toolbox and introduce artistic interventions for your clients. It can be fun. You can introduce poetry, you can use painting. All of those could be really strong therapeutic tools. So to think about what uniqueness can I bring in? Because it doesn't have to be by the book, what my textbook says I should do as a CBT therapist. It's like, no, that's part of the foundation, yes. But it's also important to remember that we can bring some of these other areas as part of that personal roadmap. Cultural sensitivity, though, is always important, as well as that self-awareness. And then using your roadmap too for that knowing thyself is to hopefully also navigate self-doubt and imposter syndrome or need for personal care during that journey. Because chances are it's going to spring up on us. Like if we've had experiences maybe where, like, gosh, I don't know if I feel good enough for this, or this client has more money than I do. How am I going to connect with them? Sometimes those little imposter syndrome moments come up, and that's normal. But figuring out a way to know thyself to navigate through them. So maybe it's a self-affirmation, maybe it's journaling, maybe it's getting your own therapy or counseling. Whatever it takes just to help monitor that. Because if you know what it takes, like, for example, if I know, like before this meeting, I got a little nervous. I get nervous before presentations. So I know what I need to do for myself. And that is I always bring a little statue of Athena next to me, goddess of wisdom, and do a little ritual for myself to moderate some of that anxiety. So, and whatever it takes for you to self-moderate is really important, knowing thyself.
And Dr. Brown is mentioning a lot of positive strengths about knowing yourself. It's important that we connect with those negative aspects of
Mhm.
ourselves that are maybe unchained. We haven't learned how to master them because that's the totality of the self, the whole, not just the things you like about yourself, the things you're good at. What about these things you're not good at? Like me taking orders from people. I don't like that.
Mhm.
Um, about my own pride. Um, and it helps me to know it because when I see it in clients, I can call out those narcissistic traits and ask them about them in a genuine way, not in a judgmental way. And ask them if they serve them in some ways, because they can serve your ambition, but unregulated, they can destroy relationships. So when Dr. Marin says know yourself, it's all aspects, all the good and bad parts of yourself that constitute a whole. And then you can bring that real, authentic self to your patients, and they'll respect that, and you'll be able to connect with them. But if you're just the facade of a counselor, somebody in a wool sweater and I don't know, a ponytail, talking like you're giving an interview on KNPR, and I see these people, and you're like, this is not a real person.
Yeah.
This is not a. This is a projection of a character, and what will happen was people will naturally pull back from that. They will find it difficult to resonate with you. But when you're authentic and genuine, you're still warm and welcoming, but also maybe you've got a little edge to you because that's part of your personality. It's gonna work, and people are gonna they're gonna be endeared to you because perfect people are perfect, but they're not lovable. It's the imperfections that make somebody endearing to another person. Those cute qualities of a kind of clumsy dog or
Mhm.
a bumbling baby or a grumpy old man. Those are the things. Think about the things you love about people and the people in your life. It's those things that give you, in spite of the fact of how they are, that you're able to connect with them.
Yeah, so endearing, very endearing. And I love the word authentic. Is this true? It's learning if to know thyself is to learn all of those aspects so you can bring that authentic self into the room, into the client to have a really honest, authentic experience with clients. And that's part of that therapeutic alliance. I mean, a therapeutic alliance is really one of the most important tools for a therapeutic outcome. So whether you become a trained in cognitive behavioral therapy or EMDR, without therapeutic alliance, it really isn't going to be effective because there has to be an established trust and collaboration between you and your client. Otherwise, it's not going to be as impactful. So thinking about, I hate when I can't see because I have my thing, camera block. There we go. So other elements that support that therapeutic alliance is being consistent and reliable. So we have to follow through. We have to be responsible. We're working with people and their issues. So if we're going to say we're going to uh, follow up on a recommendation and bring it into the next session, then it's our responsibility to do that. We really strive to be that consistent and reliable person in this person's life because oftentimes they don't have other people who are consistent or reliable. So it's also modeling that consistency. Cultural humility, it's something that you'll continue to learn throughout your training experience. Collaborative spirit, and that attunement and repair. So just as we were saying that we don't come in perfect all the time, there could be a chance where you might say something that upsets your client, or maybe you've come across as dismissive, accidentally, or there's something that creates a rupture in the relationship, and that's normal too. I've had clients get mad at me or get confused by me or just maybe, just sense that there's something that's a little off because this is a human relationship. So being attuned to that is important and just knowing that we can repair that rupture by asking them and being just bringing that immediacy into the room to talk about, like, I feel like there's something off about what happened, or I get a sense by your body language that something feels different today. I'm wondering if it was something that I might have just said. So bringing attention to it takes a lot of guts, but it's really important to build that repair. And it also shows and models to your client how to do that so they can be in a position to healthily repair in their lives. I'm going to briefly talk about that. I know we don't have a ton of time, but I know, like for me, when I work with new helpers, they often say, "Okay, that sounds great in theory, but now I'm sitting in front of a client and I don't know what to do." I get nervous or I get scared, which is perfectly normal. So I always just like to say, if anything, to explore the idea of this tool called the OARs. And what are the OARs? It's a tool that's borrowed from, or to actually originated by Dr. Bill Miller here, who was the originator of motivational interviewing, which is a collaborative conversation style. And so he really looked at Carl Rogers' person-centered theory. And with person-centered theory, it's very strength-based. You're with the client. If you've taken your history of psychology, a very different approach than, say, like Freud, where you might even be looking at your counselor. So here, Carl Rogers wanted to be more person-centered, and here Dr. Bill Miller took that model and then modified it. So then it's a little bit more directive. Started off more with addiction treatment care, but now has expanded to all other areas of the helping field so that it's strength-based, but it has a little more structure to it. So one of the tools in my toolbox that I use with all my clients, like whether they're 10, whether they're 100, are the OARs. So if there's anything that you want to say, like, well, I don't know what to do or how to start off with people, or so I'm going to have a new counseling session, or I'm a PSR worker and I'm going to meet with my new client tomorrow. I don't know what to do or what to say. It's being your authentic self.
Okay, Dr. Miranda, we're going to take
Yes,
it from the theoretical to the real.
theoretical to the real.
Okay, so
Yes.
I'm going to demonstrate the
Oh,
ORs by asking Dr. Miranda about what she mentioned, being yourself as a strength, as a tool. I really
mhm.
liked that idea. What do you consider one of your strengths that you bring to the field?
So notice what's being asked is an open-ended question. So we have an acronym here. So we're seeing this, the or is an action. So what strengths do I bring in the field? So as the client or just as a recipient of the question, I would just say I bring in a lot of empathy. I pretty good at actively listening, really striving to understand my client's story. So I'll say I'll start off with that.
Okay, from your past experience that you mentioned previously, when your interaction with clinical services, how do you think that helped kind of form some of the strengths that you bring to the field?
Well, the I I feel like I have a high level of empathy. So you're asking what my personal experience is, or
Yeah,
more?
how
Okay.
did that shape your I guess your practice?
Oh gosh. Well, I think
You had
for
mentioned
me,
a little bit about it. I just want to go a little deeper.
as far as my work as working with other counselors,
Hmm.
well,
Or patients in general. Yeah, nothing.
yeah, yeah. Well, so I learned. Well, I'll just say I'll go back and then answer this. So whether or not I don't know if I'm answering directly, but like going back to working with counselors when I was a client myself, I loved the idea of working with counselors who thought out of the box. I had a counselor, for example, who taught me yoga. Yeah, and I'm 16 years old, and this is back in the day. I'm like, yoga? What does yoga have to do with counseling? But through that, she taught me breath work and yoga, and uh, because I was there for eating disorders, learned how self-awareness of body. So doing a lot of physical tech, like just physical exercises. So I learned the importance of movement and breathing and yeah, just and having a very strength-based experience. So and now learning that and applying that and working with different clients over the years, a lot of teenagers, it's probably thinking out of the box for the most part, but also like yeah, introducing just like other types of maybe physicality, you know, whether it's just kind of some movement, drawing, tactile work, something like that.
Okay. Yeah, I can see that you have a real passion just by the way you present yourself and interest. It comes through in your tone and your presentation. My guess is that having a positive experience at such a young age motivated you to want to help other people.
So right there was an affirmation, reflection, and summary all in one.
Two sentences, okay?
Well done, well done. So yes, and because this is a real play, I feel good about what you just said. That yeah, recognizing and connecting the dots, because that's what part of this does when we're actively listening. We're able to pull for something that was talked about 20 minutes ago into the now and be able to add an affirmation, a strength based piece to that, reflect it back to your client. And then a summary is like a longer reflection of that to give me just a moment to reflect and think, like, yeah, that's a really good point. Huh,
And then
I
how
didn't
does it
think about that.
feel? How does it feel having those types of ORS questions asked to you
It
right now?
feels so good, because there's two points to that feeling good. One, to know that someone was actively listening to me. In this day and age, that doesn't happen as often anymore.
To
So
be
to know
seen.
that's to be seen, and also to hear that back, to like have someone externally put those dots together to say, "Whoa, yeah, that is super cool." Like to hear it like that makes me feel good.
Okay. Thank you
Participate.
for the time. Yeah. And we not plan this. I just sprung it on her because I can't
The
bear.
theater. It's
Yeah,
theater.
yeah, and scene.
Yes, see.
But I wanted you guys to see it in action. Dr. Miranda is a great motivational interviewing a trainer. I've seen her work. I've been to her trainings, and it can't be overstated the importance and value of these kinds of communication skills. So you might be a great communicator, a great listener. You have great heart and passion. You still have to polish those skills, and you have to keep doing them. Um, and I'm not trying to show off. Just that happens to be a bonus for me. What
Mhm.
I'm trying to show you is that it's easy once you learn how to do it, it's like dancing. Dancing is really hard at first. You're clumsy, you're stepping over your feet, but once you understand how to do it, it becomes like second nature, right? And so I have, as a counselor, done it for years. I want you guys to know that I started out where you were and I didn't have these skills. And then I acquired them. And through mentorship training and getting feedback from supervisors, I was able to hone those and sharpen them. And so I don't want you guys to feel insecure, but motivated to learn. That's all. So thank you.
Yes, and what was interesting is that I manipulated my Zoom where I couldn't see anybody's faces, so I'm just listening to the questions. So just to know, like even listening, like through like this could be done virtually or phone call, like I still had the same amount of feelings of being seen and heard, even just through a voice. So this is very powerful, as far as interpersonal skills. So if you have a chance to take just even Google ORS or could practice, it's really can be affect interpersonal skills in all areas of your life. I go to parties and I ask open-ended questions. I give affirmations, which is like seeing something positive about someone and letting them know. I'm reflecting to people that I'm listening to what they're saying. So these are all just really good communication skills to have in general. So I know we only have a few more minutes left, so I'm just going to quickly go through uh, the just a little few more slides.
You have time. There's no rush.
Okay, no notes. So yeah, we talked about just seeing this in action. So again, open-ended questions can be just so powerful and versus like what there's just like how does that make you feel, right? Is always like the go-to that we see on TV. And oh my gosh, there's like a hundred different questions that you could ask. How would you like things to be different? What makes you think you could do something? What would be the good things about changing? What would be the challenging things about changing? So there's just a lot of open-ended questions to really get that person to open up, even teenagers. It's hard for a teenager to say no, or I don't, well, I guess I could say I don't know, but usually I'll follow up with another open-ended question. And then affirmations are what I like about motivational interviewing, if you were to ever explore this modality, is it's very strength-based. It trains us to be strength-based. So as we go through practice, and even if we're listening to somebody who stole a car, robbed somebody, using substances, and they're listing all these things that on paper could maybe not agree with our value system, there's something in there in that with that client where you can find a strength and you could affirm and you could say something positive. I go into juvenile detention centers and I would recognize their communication skills or their artistic skills. You would see them light up in that moment because it was almost like that was the first time somebody said something positive to them and meaningful in a long time. So finding something a strength in that client and reminding them of it, and it's a way for for them to be seen. So you have a strong work ethic based on what you've said. You really care about being a good mother. Uh, you cooked successfully, difficult situations. Just as long as it's authentic, it can feel really good for our clients. Reflective statements is just being able to reflect back content, what people have said, reflecting back feelings, maybe reflecting back body language, just being able to say, like, it sounds like you're feeling this way, or from what you've said. You've said that you are a single mom for a long time and you've overcome that, and here you are today. Like, there's just ways to kind of reflect in your own language what you heard and reflecting it back to let them know that you've been listening. And summarizes is kind of like what we just saw at the end, like 2 to 3 sentences that kind of ties everything together and lets either that client resonate with what was said, or they could say, it's a nice way to transition in another direction too, in a polite way. A couple of other things that that's as far as strength-based when you're working with clients is really doing our best to promote autonomy and self-efficacy. Because we never want our clients to have to depend on us for the answers, to rely on us like, oh, like I can't make a decision until I see my counselor next week. We don't want that. We want people to feel empowered. We want them to come up with their own menu of options. So remember that that's important. It's just do whatever we can to help remind client that they're their own expert. And we can even practice it in therapy with them. Would you like to draw? Yeah, this is what you can do with kids. Would you like to draw a picture or play a game? And giving them that decision to make. That's an opportunity for them to build self-efficacy and decision making for themselves. And then we can start expanding it like, okay, as far as cutting back on alcohol use, what have you come up with? And coming up with different solutions and ideas. So promoting that self-empowerment and self-efficacy. But coming back to that sign of subconscious communication and therapeutic alliance, it's also believing that our clients can change. Because if the back of our heads we're thinking like, oh gosh, this person's come into substance abuse treatment 5 times already. What's going to make a difference this time? And we're thinking that, but maybe not saying it. It's going to be conveyed subconsciously in our communication skills with our client. So we need to believe that our clients have an ability to change, improve, make a difference, because even our thoughts matter in the relationship, as well as language in front of in your closet, I mean your closet, in your office, outside the office. So whatever you do, do not disparage or just ever say anything negative about clients. It used to just drive me, just make me very upset to work in a substance abuse treatment, and behind closed doors, people would say, "Oh, they got another dirty UA," or they are using just language that was just not positive or respectful. So even behind closed doors, monitor that language at best to make it strength-based and respectful.
Yeah, because you undermine your own efforts. If you dis if you disrespect your patients and you are in the service of your patients, then you disrespect yourself and your whole mission. And that sabotages all your efforts. And you also have a sense of disease with yourself because on one, let's say in your work hours, you're trying to be helpful and positive and set a good example. But then when you're off, you're complaining and you're disparaging your patients. You're forgetting the fact that they're human and other people hear and think about you as a counselor. So, is this what counselors do? And so we do have our time that we might want to talk about something and need to process something. But if we let ourselves just go kind of without any kind of ethical consideration for our patients and ourselves, uh, nobody wants to hear you complain anyway. Just remember that. If you have somebody in your life that cares enough about you to listen to you complain, monitor it and give it to them kind of succinctly. And if you find yourself complaining over and over at the same thing, this is your problem, not the world's problem, not the environment. So when I work with interns that I'm training to be counselors that are about ready to get their license, I tell them, don't take all your problems home. Find a way to deal with them because your family and friends didn't sign up to be a therapist. You did.
100%. Yeah, because that's what contributes to burnout or compassion fatigue. When we go home and we're thinking negatively and having negative thoughts, and I'm not making a difference, it becomes that's a sign that cynicism means that there needs to be just a different work-life balance or just a break from the field or personal therapy when those negative thoughts become more and more common. So a way to just to just again know thyself and know like, oh my gosh, what if I see that negative Nelly kind of coming through again? It might mean I need like a little break or I need to do something for myself. So that language can be very a big indicator of that. Some other just interventions too, just motivational interviewing is one modality, but I just really wanted to introduce the idea that there's so many interesting interventions out there that maybe you like to learn more about because sometimes these aren't always listed in the books. So if there's something out there that's some of a creative nature, chances are you can incorporate that in your work. So if you love books, for example, bibliotherapy introduces the idea of using books with your clients, of course, who would also be interested. We don't want to suggest something to a client who, if they're not a reader, this is not something you want to propose to them, but maybe they are. So maybe they are trying to work through their own imposter syndrome, and you found a really good book on that, and that's something you can discuss. Or a movie or creative arts or doing things that are more somatic with the body. So just knowing that there's a lot of experiential activities that could be woven into. Some require formal training. Some you can bring in your own ideas, that out of the box kind of thinking, like I mentioned. So as I start to wrap up a little bit, thinking about like what can you do to promote your journey? And we covered a lot of this already. Just to reiterate, this training, your coursework is so important. Even though like doing a discussion post may not always feel fun in the moment or like, got to go through the motions of this. This is the formulating you as a helper and future counselor. So these exercises are very important because they're going to reiterate what you've learned and how to interact with your professor and with others. Uh, can't emphasize the idea of finding a mentor or even just someone in the field, someone you could ask questions to someone you can reach out to. So important. Books, podcasts, websites. I know a lot of you are very busy, but just knowing that there's so much out there. But then also learning how to discern, because again, things on TikTok may not have that scientific support as if something that may have some publication resources or citations under it. So learning to discern, but just know there's a lot of good information out there. Connecting with each other. Oh my gosh, if there's student organizations or an opportunity to meet or starting your own virtual rooms, you're each other's peers. So I know like I'm still best friends from my master's program with one of my classmates, and that's 20 years ago. So these are the important times to connect to others and your classmates. Activate curiosity. This is something my professor OSU taught me. Like, even if it's something that's not necessarily in your field, like to expand who you are by learning a new language or a new activity or travel something new, because all of that is going to help with your cultural sensitivity and as well as just making you a more robust helper and counselor. So, curiosity can really serve you. Uh, Knowing that your journey is your own, and so it's okay wherever your road takes you. Knowing those personal strengths and those challenges, and embrace your uniqueness. It's just really something I want everybody to take away with. This is a picture of the wellness wheel. So if we feel like we might need a little bit of support in our areas, I always look at the wellness wheel to say, like, is there an area here that maybe needs a little bit more extra work? If I'm a little lost, and usually like looking at the wellness wheel, if you Google wellness wheel, sometimes gives you that right clue, like, oh, okay, yeah, it's probably the physical wellness piece that might need a little extra work. So just to keep us back on track. Very important. And I use this with clients all the time. Uh, that is it for the presentation, but I also wanted to give just a plug, if I may, for Be Here Nevada. I will make sure that each one of you has a copy of this. I'm putting together a virtual summit next Friday from 1 to 4, free, and again, it's virtual, where I will be featuring 10 different helpers from the field to talk about 10 different topics. It's going to consist of breakout sessions, meeting different providers, social workers, community health workers, marriage and family therapists, clinical professional counselors in the field. So when we talk about mentorship, this is an opportunity to say, like, gosh, I really liked Desiree's presentation. I might reach out to her because she might serve as a good mentor. Or maybe I just like the idea of learning more about authenticity from Hazel. So I will make sure everybody has a copy of this. I think it's just going to be a great opportunity to connect, learn, network, and just, yeah, gain new experiences. And then also make sure everybody else has a copy of this. Be Here Nevada has training funds. So for any of you who are thinking perhaps of becoming a drug and alcohol counselor or a community health worker and might need some financial support with examination fees or certification fees or materials, We have up to $1,000 stipend for applicants. Please take advantage of some of the funding that we have available. So I think this we're pretty much there on time. So
Yeah, it's perfect. Thank you so much, Dr. Miranda. We're gonna let Dr. Miranda go. She's given enough of her time. I want you guys to all stay on, and I'm gonna do a little bit of housekeeping. So, thank
okay.
you so much. We really appreciated your presentation. I saw some amazing comments. I don't know if you had a
Oh,
chance to read the comments. One from Dory says, "As a busy mom of three, it's refreshing to hear you speak about being a mom and still crushing your goals. Thank you for your inspiration."
oh.
Um, there was a lot of positive comments about my presentation. And so, yeah,
Uh,
there's a lot of they're amazing. Thank you for your time, and I
oh,
do appreciate it. Um, we are Dr. Miranda's in the top of her field. For her to be and share her time with us this evening is really a gift, and I do appreciate it. And I thank you from the bottom of my heart for being here. So. Thank you and good night. The rest of you folks hang on and I'll give you guys the passphrase and some housekeeping.
all right. Well, thank you all. As I mentioned, I love working with students, so I am still very passionate about this, and I will make sure that you all have my contact information. So thank you so much, and have a great evening.
Good night. Okay, guys. Thanks for your participation and being so kind to our guest. I did want to give you the passphrase for the is bunny, bunny, bunny. Come, I think spring's here and Easter's coming, so you won't forget that. Yeah, for those of you who don't know, you're going to put that passphrase in your assignment for any class that you have this assignment for the was it? Yeah, I was gonna do Easter, but I didn't want somebody to say something about it's a religious holiday, so I changed it to bunny. Um, you must have been reading my mind though. Uh, I know there was a couple questions that maybe didn't get answered. We've got about 10 minutes left, and I can answer those questions for you. One of them was something about negative thoughts that, where is it? I lost it now. It is normal to have negative thoughts, but they shouldn't be pervasive. So you should have healthy amount of negative and positive thoughts, and we can speak to those negative thoughts. It doesn't, and it might just kind of be your personal makeup, but monitoring yourself and moderating yourself is really important too, because the more negative thoughts we think about, they can produce more. So we can break the cycle, right? Also, there was a question about what of those interventions that was listed are appropriate for a CADCI. Oh, that's not something that we can really. All I can say is you have to practice within the scope of your practice. So if you're trained within it, then you can use it. If you're not, then you probably need some training first, and then you can use it. So I would ask my supervisor if I was an intern, CADC intern supervisor, about an intervention if they knew anything about it, and they might be able to help direct you or give you a resource that you can look up. We can self-train, but it's good for us to have some external um, credentialing. So go to a workshop or go to a training event for professionals, and if you feel confident about, then you can do it. Having said that, I've always I think when you're educating, you're not acting as a clinician, you're acting as an educator, and that doesn't necessarily require the same level of expertise, if that makes sense. Any other questions before we call it a night? Um, what's a good time? So Keaton's got a question. What kind of time frame to consider working with a different population? I don't know what you mean by time frame. You mean like within your training, um, or your education? Yeah, so Juanita's asking about the Be Here training fund. So those QR codes are there for you guys to take your phones out and scan them, right? So that's one thing you should do. The other thing is I dropped the link to Be Here in the chat. It's BeHereNevada.org, and you can go to that website and look at all the resources that are there, the training events, everything. I just put the link back in there so you have it. But when somebody's presenting, pull your phone out, take a picture, write something down, whatever you need to know. This is part of you being resourceful. I want to see that in you. That's a skill that I want you to demonstrate as you're going through your education program. Aurora says slightly off topic. I have not heard from Dr. Munoz. I have reached out multiple times. Okay, I don't. You're going to have to email me. I can't answer that. So Aurora, just email me if you have a question, or I can get a hold of Dr. Munoz. Okay. Yeah, Keaton, like you're such to finish answering your question. The right time is to start working while you're in internship, because that's where you're getting supervision and training as part of your academic experience. Anything else before we go? I do appreciate all the questions. They're just kind of coming at me fast. Normally I have Dr. Wentz here to help me, or I take the question and he lectures. I think I just kind of naturally came about, but Dr. Miranda is a master trainer in motivational interviewing, and it just happened to be that the last session was on motivational interviewing. So I think you can see its benefit in the field and its wide range of uses and the ways that it can affect change with clients. So last time I'm going to put the passphrase is bunny, 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 and submit that for your assignment to get credit for being here. Thank you guys all for coming and being very respectful and interested in Dr. Miranda's presentation. I do appreciate the way you present the school, and I'm very proud of all the work that you guys have done. I know semester's getting on, and it's getting finals and everything are coming up, and ends of practicums are coming up, so there's a lot of stress, but take the time you need to relax, recharge, and then get back at it and make it to the end of the semester. If you need something, I'm always here for you guys. Just give me a call or email me, and I'd be glad to answer any questions you guys have. So with that, everyone have a great night, and thank you.